Hello. Hello, my name is Kylie Steen, and today I'm going to be taking you through two contemporary and emerging healthcare models that support the empowerment of older people. The proportion of older people in the Australian population is increasing. Older people over 65 will represent 22% of the population by 2061, according to Hancock and the Australian Bureau of Statistics. Growth and ageing of the Australian population means there will be more people seeking care in the future, meaning that more hours of care provision will be required. Today, many people prefer to age in place or live independently at home into advanced old age, a preference that is supported by Australian policy initiatives, priority and funding for aged care services. Aged care is provided in people's homes, in the community and in residential aged care settings. Aged care varies from low-level support to more intensive residential aged care. The Commonwealth Home Support Program is intended to provide entry-level services focused on supporting older people at home and in the community. Home care packages 1 to 4 provide many of the same support services that are available under the Commonwealth Home Support Package, but may offer a more structured and comprehensive bundle of services. Residential aged care provides support and accommodation for older people who are unable to continue living independently in their own homes and who need ongoing help with everyday tasks. In 2018-19, aged care services were delivered to around 1.3 million people. The most commonly used service in 2018-19 was the Commonwealth Home Support Program, about 841,000 people, followed by residential aged care, about 243,000 people, and home care packages, about 133,000 people, according to the Aged Care Royal Commission and Dwyer. Aged care is based on a number of philosophies central to the principles of empowerment and enablement of older people. They include person-centred care, which is based on Tom Kitwood's 1997 work. The development of this philosophy centres around personhood and partnerships as fundamental for building tailored care that meets the goals of the individual. Reablement is a short-term restorative care approach that includes a number of evidence-based practices such as wellness, active ageing, early intervention, prevention and social inclusion to achieve agreed goals and outcomes for the older person. Human rights and social inclusion philosophies promote access to appropriate and adequate aged care facilities and healthcare. These principles are incorporated into the Commonwealth legislated Aged Care Act, the National Quality and Safety Standards, and the Aged Care Quality and Service Standards to protect patient capacity and safety. Ageing in place provides older people the support they need to live safely, independently, and in an environment of their choosing. And finally, integrated care purports a seamless, effective, and efficient care that reflects the whole of a person's health needs from prevention through to end of life. The two models I'm presenting today are emerging models exhibit these philosophies of aged care and includes small-scale domestic living models and technological approaches. A small-scale domestic model activates residential and dementia-specific care in a home-like physical environment of up to 16 people. The routines are flexible versus task-orientated. Staffing covers personal care, domestic and leisure care tasks, and the residents have the opportunity to engage in these according to their wishes. Support and care is tailored to needs and preferences of each resident and is focused on person-centred care and resident engagement. This encourages personal-centred care that maximises the independence of the person and is found to impact on resident quality of life, well-being, reduced anxiety, depression, fewer physical restraints and psychotropic use, as well as fewer hospitalisations, increased engagement, and improved physical activity. The small-scale domestic model for residential aged care offers an environment that draws on the philosophies of person-centred care and enablement. It supports the building of meaningful relationships. The feeling of being at home preserves personal identity, continuity, belonging, and supports consumers keeping active. This is achieved through both the social and organisational features of small-scale living, which contributes to autonomy and relational autonomy through the social environment. Independence and self-determination of action, thought, and speech is also featured, which supports exemplar models of dementia care. Small-scale models of residential aged care are not widespread, and much of the current evaluation and research is non-randomised and has limited methodological quality. There are also additional areas of study such as cost analysis and cost efficiencies, consumer preferences, and impact on consumer activity. With the proliferation of technology in modern society, there are now many new and emerging technological approaches to aged care. These may include monitoring devices and systems, including self-monitoring sensors and biosensors or motion sensors, such as wearables and health smart homes. These provide data and measurements of the health condition of the individual, allowing it to be interpreted and assessed on-site or virtually. Health smart homes are spaces equipped with sensors that provide messages or alerts as to the health status of participants. Assistive and supportive technologies provide physical or cognitive aids to care, enabling improved access to the lived environment, exercise, and social participation. They can also improve safety, especially around falls with detection and motion sensors. Robotics is an emerging area where they have been employed to assist with tasks of daily living or even provide a substitute for socialisation. Communication technologies such as home telehealth, where telehealth consultations can be provided at home or on site, have been expanded since the COVID-19 pandemic. Intelligent health information systems such as mobile apps to manage day-to-day health needs are having an emerging application across all aspects of health and community aged care. Technological approaches may offer a low-cost and sustainable way to assist older people to age in place. Of particular advantage is the possible solutions for support and safety for independently living people who are susceptible to falls or isolation. Telehealth and monitoring technologies can also provide better access to healthcare for people in community and residential settings. At present, these technologies have demonstrated viability internationally, but are not adopted at scale for the ageing population in Australia. Proposed benefit to older people has occurred with little consultation with organisations that support older people or older people themselves. Understanding and therefore the acceptability of technology is yet to be assured. Rollout into the aged care settings will be complex and will require coordination across all sectors. Older people have identified that they want alternatives to residential care, a small-scale model that meets the requirements of care that older people have identified, such as reablement and rehabilitation support and facilities, support for independence, exercise and sport opportunities, lifestyle, quality diet, flexible routine outside mealtimes, and independent access to outdoors and the community. A small-scale residential model that meets these requirements of care for older people deserves further development and exploration. Consumer-directed care is a means to provide autonomy and choice for older people. Support with solutions that make tasks easier through the use of technologies may give consumers more control over the way their care is delivered. Confidence in the use of these technologies will be paramount to its incorporation and success. Both models presented offer a contribution to the care and support of older people. They harness the foundational philosophies of aged care and represent a reframing of both ageing and aged care. Thank you.